Are there developments in advanced non-melanoma skin cancer treatment and research that patients should know about?
So, in the past, as a medical oncologist, we used to use a lot of chemotherapy. So these are drugs that, are notoriously hard to tolerate. Patients understandably are fearful of them, and many of them don't want them. They've seen friends and family go through them. And frankly, they have not been the most effective or efficacious in treating non-melanoma skin cancers traditionally. But in the past, that's all we had. Now we actually have much better therapies, specifically a category of drugs called immunotherapy drugs that really boost a person's own immune system to fight the cancer. These drugs are fairly new in the cancer world, and certainly new in the non-melanoma skin cancer world. And so many of our colleagues in the community may not necessarily think when they're considering patients. Perhaps a lot of our patients haven't even gotten a chance to hear about them. And so, yes, there are new developments that I think are worth considering earlier and earlier in the course of a person's treatment course. And so I think an earlier referral to these multidisciplinary team members, including a medical oncologist, may not be a bad idea.
Yeah. How can patients stay up to date on developing research? What's available for them?
So, there's skin cancer patient advocacy websites that they can check out, skincancer.org. They can, I always tell patients to be careful about what website they're checking, because I certainly don't. I want them to go to a website that's reputable, that's vetted, that is something that we think has accurate information, that's evidence-based. And so, AIM at Melanoma has a non-melanoma skin cancer educational website. It's called SCIRF, which is Skin Cancer Education and Research Foundation. And you can find that through the aimatmelanoma.org website. You can look at skincancers.org. You can try with American Cancer Society, or you can even ask your clinical care team and see if they have any suggestions. There's a lot of resources out there. I would just urge our patients to be careful in what source they're looking at, just to make sure that they're getting accurate, evidence-based information.